Hard Hat's all about showing up to play hard, doing what it takes to win.
If you want to cement legacy, win another.
He's your third center.
You don't want to pump him up too much, but it's hard not to.
This is maybe the most I've ever agreed with you.
Hey, Brian Manning here. Welcome to another Garden Report. We just got off the air about 10 minutes ago here on Tuesday, but one of the biggest news stories in all of basketball right now, and certainly around the Celtics world, is Jayson Tatum undergoing surgery today for a ruptured Achilles. We all saw the injury yesterday. We all had concerns into today, and then just a couple hours ago, we got the news that he did undergo that surgery in New York. So we're going to bring in a medical professional to talk about it. Erek Latzka, Dr. Erek Latzka is here to tell us all about the Achilles tear and possible treatments and recovery time and all the different things that are under consideration now for obviously the most important player in the Celtics present and future now. And unfortunately, for the near future, they're going to be without him here, Erek.
Yeah. Thanks for having me, Bob. It's a sad day for Boston for sure, and especially for Tatum and his family. At first, I just want to say, prayers for him, his family. This is a hard injury, not just on him and the team, but also, his kids, his wife. It's going to be a lot for everybody to step up. I've been through this. What he's dealing with right now is, probably a lot of just mental grief and depression. And we'll talk a little bit about that too. So I just want to first say, prayers for him and everybody around him.
Yeah. And as we always say with this kind of stuff, and I know you want to stress here, like, we don't have the medical information in front of us. You're not inspecting the injury here, and we don't even know what kind of surgery he had today and all the rest. So a lot of this is going to be speculative to some degree, but also, you've had experience yourself with the Achilles tear and treating it, of course, and, know all about this stuff. And I feel like there's a lot of similarities between a lot of these injuries that players have suffered here. And obviously there's been many different outcomes for players coming out of this, but this is a difficult one. And I wonder, first off, what makes this such a challenging long-term recovery, as we've seen it derail numerous careers and cost players entire seasons, and just be an extremely difficult one, maybe compared to some other injuries that basketball players suffer. Yeah.
It's just such a strong, the whole complex from the Achilles to the muscles that are above the Achilles, the gastroc and the soleus. It's just such a strong, forceful muscle that you need it to be able to do the explosive movements that Jayson Tatum does. And if you lose that, it atrophies so quickly. And so a lot of the recovery is just, once it's back together, it's regaining all of that strength and explosiveness, and doing so at a rate that doesn't put you at risk of then tearing it again. That's the hard part, the trying to struggle between how fast and how slow, what's safe, and when can we get them back on the court. There's no other injury aside from maybe a patellar tendon rupture in the knee that takes as long to recover from.
Yeah, and that's another rough one you hear about a lot. In this one in particular, I'm curious, you see the injury happen in real time. I think everybody, for the most part, who knows about this stuff identified it as such when they saw it. What stood out about that play, the way he planted the foot? I was on the 9th floor, so I thought he turned his ankle or something, or maybe someone fell on his leg or something like that in that moment. But you see it on the replay. There's no contact, just pretty much plant, and then goes down in a heap of pain there. I also wonder, is that something that built up over time potentially, or is that just something where you step in that instance and the awkwardness of the step makes a tear?
Good questions. First one, the mechanism. His foot is what we call dorsiflex. So that means, his toes are up towards his knee. They're kind of bent backwards. And when you're in that dorsiflex position, there's a lot of tension on the Achilles. And so when he's stepping back to plant, it goes into that dorsiflexion. And then the explosion where he's pushing forward off of it is the risk. So that's a position we've seen with Damian Lillard. We saw it with Kirk Cousins on a much less explosive, position when he was just stepping backwards. Similarly, Aaron Rodgers was in that position. He just had a 250-pound linebacker on his back. But the tear always happens in that dorsiflex position when there's a attempt to put a load through it. So when I rewatched the replay, I knew what it was right away. The other thing that gave it away was just his reaction. There's not many other injuries in sports that get that kind of immediate reaction from a player in terms of the immediate grieving and also grabbing towards the Achilles. If he had grabbed his upper calf, we might have considered a calf tear. If he had grabbed lower on the ankle, maybe an ankle sprain or even an ankle fracture. But he was, his hand was right on that Achilles, and you could tell.
Yeah, so the immediacy of the immediate nature of the surgery there, and I do find it interesting. He does undergo it in New York there. What kind of considerations are there? I know I was reading the Globe, and what some of the reporting they had there is that there could be a better outcome by getting this done quickly the next day. Is certainly pretty an urgent move there. Is that typical in this situation? Is there perhaps a doctor in New York that really specializes in this? Like, is there any significance to maybe where and how quickly he had this surgery?
I think there's definitely some urgency for this procedure. The longer you let it go, the more atrophy, the more weakness you're going to get in those calf muscles that you're going to have to come back from. The other reason, and this is conjecture, but as far as I know, in Boston, there aren't many surgeons. I can't actually think of one, and I'm probably wrong, but the surgeons I know at MGH aren't performing the speed bridge technique. Now, I don't know and we can talk a little bit about that, but
I'm very curious about that.
The standard repair is essentially suturing the two ends of the Achilles back together with lots of suture, strong Teflon suture sometimes. And that's a very successful procedure, but typically it requires 9 to 12 months recovery. So the speed bridge is internal bracing. Basically, it's reinforcing the Achilles with a device that's implanted into the heel bone, into the calcaneus. And this hardware that goes into the calcaneus then provides extra support to the Achilles. It's been done for 7 or 8 years. It's becoming more common, mostly in professional athletes, and it has gotten athletes back faster. Some of those, probably the fastest was Cam Akers. He was back to playing in an NFL game by 5 months. Aaron Rodgers is the controversial one. He said he was ready at 4 months, but he didn't have to really go back to any kind of game play until the next season. But when we think about NBA players, there haven't been any that I can think of that have had the speed bridge yet. Maybe
I wonder why that would be.
It's a relatively newer technique, and at least in terms of the stars, I'm not sure what Damian Lillard had. If we go back to Durant, he had a regular repair, and his recovery took 18 months. If we think about Kobe, he got back relatively fast for a basketball player with a regular repair. His recovery took about 8 months. But, not all these players, they come back, they aren't necessarily the same, right? They're a little less explosive. They aren't moving like they used to. I think we can always tell. But so I hope that Tatum's the exception. He is a little bit younger than most of the basketball players who injure their Achilles. When I mentioned Kobe and Durant, they're a bit older. Your second question earlier was there something that maybe had predisposed him to this? And that's going to be the question that another question everyone's asking, right? Was there something that predisposed him? Was there something he could have done to, possibly avoid this injury? And there's never going to be a good answer to that. A lot of these injuries happen randomly, without any without any prior Achilles tendonitis or Achilles tendinopathy. We'd love to say that, we probably would have seen a partial tear on a MRI or ultrasound if we had done it, and maybe we could have avoided this and shut him down. But oftentimes these things happen completely unexpectedly to somebody who's feeling, 100% and in their prime. Yeah,
and there's so much to consider there, but you say something that probably is my biggest question, and everybody's biggest question is how effective will he be coming back from this? Will he be Jayson Tatum that we just watched to start this postseason and this entire season and 4 straight All-NBAs as it's going to be here early in his career? So. You would think the youth would help him with that. And we haven't seen a lot of cases. In fact, we were just doing a show thinking about some other guys who have gone through this. And unfortunately, someone who was his age and didn't come out of it well was DeMarcus Cousins. His career effectively ended after that, and different body. I think he was a really heavy player
Bigger
who I
guy,
think there was
yeah.
just a lot of force on that lower leg area, but explosiveness, big part of Tatum's game, and that's something you think about there in terms of like his health after this. Like, does this lead potentially to more struggles with your health overall? Are you the same player explosively after something like this? Is it possible to be that same guy after this surgery?
I think it's possible. I think, he's a lot younger than Kobe. Made a remarkable recovery with, probably, if he got the speed bridge, a less helpful, a lesser surgery, essentially. If he got a better surgery faster and he's younger, and he's as motivated as Kobe, that's probably his idol. He's going to be looking at everything Kobe did and trying to do it as fast or faster. So I'm hopeful, optimistic as a physician, as also as a fan, and as a local Massachusetts native. But you never know. You never know with these things. If you talk about just regular Achilles ruptures and in professional athletes, it's about 25-30% of them don't actually come back to play. But those are a lot of people who might not be as well known. They're on the fringes of the rosters. They might not make it back, and they aren't at the level at that level after an injury. Now, superstars like Tatum, Durant, Kobe, they can slow down a bit and still be an effective player in the NBA. Will he be the same? I don't know.
So what are the stepping stones going to be in the recovery here? Obviously, in the near future, it's going to be, leg up, not able to do anything, bare weight, all that kind of stuff.
I mean, right now, he's at home in bed, just hopefully sleeping and, trying to deal with this mentally. I think the first thing he's got to overcome is that grief and depression. He's an athlete who's played up until this point in 121 out of 121 postseason games, never had to miss significant time with any big injuries. And, for the first time in his life, he's going to be not athletic and not able to do use his body the way he wants to for, the foreseeable future.
So he'll obviously miss the start of next year. I know you're saying like 7, 8, 9 months potentially here. Other guys have taken longer. Does it help potentially a better outcome to miss all of next year, miss more time, take as much time with this as possible? Is there benefit to maybe coming back late next year in that 8, 9 month range if he's ready to go at that point, just to rebuild, your confidence at that point and, get comfortable playing again?
Your biggest risk is a re-rupture, right? And that's the thing that everybody wants to avoid, because
so you got to be careful with that.
You got to be careful. And the other reason you can't rush people back too soon is because the main goal of the Achilles tendon surgery is to regain the tension on the tendon. So what they do is they start you out in this position where your foot is the opposite of what we said dorsiflex before, but now it's plantar flex. So now your Achilles tendon is in this very shortened position. It's very relaxed. And then over time, they slowly stretch your Achilles back out. Now they can do that various ways. They can do it with serial casting, heel wedges, but they don't want to rush that back, because if they overstretch the tendon, you can never get that tension back. And so they'd rather it be very tight and slowly over time build up the range of motion. But if they overstretch it too early, then he won't have the amount of tension, and that will not allow him to have that kind of recoil and explosiveness when he's trying to sprint or jump.
Yeah, and I don't think there's any reason to rush it, given that the earliest you would think he'd come back is the very end of next season, based on the timing right now that we're talking about. What do you usually see in terms of like the most common amount of time a player is coming back from this sort of thing? Like, what's the most typical recovery period?
Typically, it'd be about 9 months.
Yeah, and you're talking March-ish. February, March, April next year.
I mean, maybe he's ready for playoffs, but that's not really the best kind of time to come right back into playing. You go from practice to playoff speed. That could be risky in and of itself. So, I don't know what that'll be up to the team and obviously Tatum.
Right, for sure. And you said you went through this as well yourself.
I've actually, unfortunately, ruptured both of my Achilles. I ruptured my first in my senior year of college. I was a track and field athlete at UNC Chapel Hill. I took some antibiotics in Ecuador over the summer that can actually predispose you to Achilles ruptures. Ruptured my first one a few weeks back at school. And that was the first time I was ever, not an athletic athlete who could do what he wanted with his body. And I was pretty depressed. It was also the same month that Tom Brady tore his ACL, so that didn't help either. And then I tore my second one doing what everyone around Massachusetts is doing now, pickleball.
Wow.
So
I didn't know you were tearing Achilles on the pickleball court.
That was more recent. But so I've been through it. The good thing, there have been some good changes over the 15 years between when I first tore mine and now. And so Tatum's going to get a better outcome than what I got 15 years ago. The PT protocols are faster. They get you out of the boots earlier. They start range of motion and strength training earlier. And I think we used to be scared to do those things because we didn't know if we were going to cause a re-rupture or overstretch the tendon. But what we've seen is if you do it in a slow and controlled way, you can do it safely and get people back earlier with less weakness.
Yeah, a couple other things I'm thinking about here. I know a couple of people have mentioned this. It's not something that sticks out to me, but you would think a righty would be jumping off his left foot most of the time, and I'm sure that's what Tatum does here. I can't really think of it off the top of my head.
Yeah,
a couple of people are talking about that in the chat. That's probably helpful that if he is a left foot jumper, that this is the right foot. Potentially here that, he'll still have that maybe stronger plant foot that he's, bursting off or jumping off around the rim. Like that probably is a positive here if that's the case, right?
Yeah, I think that's one silver lining you could look for. But I think he'll just have to, you train both as you come back. And
yeah,
I don't know if it's really going to matter. It's going to alter his gait until he can. It'll be probably a year, even if he's back at 9 months. He's still going to be thinking about it a lot, and that's the other thing. That trying to just get past it mentally, not be afraid of that step. And I think even after you're back, you got to be back and playing for a few months before you can start to forget about it.
Yeah, and does it take some management when you're coming back initially? Like, is there a minute limit, that sort of thing, usually when guys are coming back?
Yeah, and especially in the NBA these days, right? I mean, there's always load management now. So I'm sure they're going to gradually get him back when they do.
Yeah, it's just devastating. I mean, this is the last thing you ever want to see any player suffer here, and the timing of it is terrible. And again, this is one of the more durable guys
I know.
we saw across the NBA throughout his career. I think he's missed just 50 games, a little over 50 games in his entire regular season career. He just missed his first playoff game ever last series here, and now he's going to stand to miss most of next season. The process will be interesting here. I'm sure they're going to be super patient with it. Is there anything else that you think about with something like this, the experience? And, I think that last piece you mentioned there is important too, of regaining your confidence and, building up your ability to play at the level you were again. That's going to take some time even when he does return.
Yeah. Questions I get from patients, every day are like, what can we do to hasten recoveries of tendon injuries? And they're asking me about things like platelet-rich plasma, which we do, and stem cell injections, peptides, hyperbaric oxygen, shockwave therapy. There's all these things, right? And we don't really know. We don't have good evidence that shows they improve the recovery from a full Achilles rupture. There are lots of studies out there looking at putting PRP or stem cells into the tendon right after surgery, and does that help? And so far, most of the data says it doesn't. You probably have enough. You probably have enough, cells going to that injured area after a surgery. You don't need to inject additional ones. Peptides are something, and I think people mention. They always ask me about BPC-1 peptide that can help tendon recovery, but it's one that's definitely not allowed by the World Anti-Doping Agency. It's on the banned substances list. So, some options that you and me could take, that's not going to be an option for him. And then, there's a lot we just don't, hyperbaric oxygen. There's a lot of athletes doing that for recovery right after an injury. We don't really know if that's going to help. Probably not going to hurt. The main risks for him right now, would be the one thing that's interesting is a very high rate of blood clots in Achilles ruptures. So about 50% of people with an Achilles rupture and surgery will develop a blood clot in their calf. So for that reason, they usually put you on blood thinners to avoid that risk. And I'm sure that the medical staff is doing that. Hats off to them. They offloaded his Achilles immediately. They didn't let him put any weight on it, because at the time they didn't know if it was a partial tear or not, and they were obviously wanting to avoid making it worse. And then getting him into surgery the next day, I think they did a great job.
Yeah, they got him out of there fast. He was in a wheelchair, and you mentioned like the emotional toll too. You saw it in his face there, and even when the injury happened, it felt like he knew in that moment what happened. You usually do, right? From your own experience as well. It's a pretty unique feeling.
Yeah, you think somebody either shot you in the back of the leg or kicked your leg out from under you. It's a loud, very audible, thing that you feel, and I'm sure he knew it right away.
Yeah. So people in the chat, if you got any questions here, we'll try to get to some of those before we wrap up here. I did see some I wanted to get to from further back here, but yeah, if you have any new ones, feel free to throw them in the chat here. Let's see, where is this one I was looking for? Oh, here we go. One thing I did read today, this was a record. Jeff Stotts, I believe his name is, tracks a lot of injury stuff around the league. I believe this was a record year, at least in his tracking data, for Achilles tears, numerous ones around the league. What could be leading to this in the NBA in particular, in Tatum's case, or is it just kind of a fluky thing this year? You feel like that a lot of players did end up tearing their Achilles?
Yeah, there's a lot of conjecture about why this is. I think players are definitely stronger and bigger and faster. They're training more. You look at the NBA 20 years ago. Guys weren't. Not everyone on the team was jumping and moving and as big and tall and as lengthy. The bigger and longer you are, the more force is going to go through those tendons. And as rosters continue to get bigger and longer and more athletic, I think you were going to see more of those. We're not seeing many Spud Webbs out there anymore, right? We're not seeing those small guys. And so as the NFL and every league keeps getting bigger, I think we'll see more tendon and ligament injuries. That could be one. Tatum's case in particular, I mean, he probably played more minutes in the last 2 years than a lot of people, through the NBA.
You wonder if that plays a role, right?
Into the Olympics and right back to it. But you never know. You can't fault him for playing the NBA Finals or playing in the Olympics. Like you can't try to live your life scared. And I hope he doesn't regret playing in any of those moments.
For sure, and I do wonder what leads up to some of that. It's just probably so tough to tell, especially at this age. Again, I can't think of too many players who've gone through this at this age. You normally think of guys in their 30s, end of their careers, that sort of thing. So, the big question everybody has, again, we talked about it a little bit earlier, what level will he get back to here? And does age work to your advantage, given that he's on the, right side of 30 here?
I think you have to look to other sports for comparable age, athletes. And I think in football, you've got Cam Akers, who is younger than him. And then you have, J.K. Dobbins, who I think was around the same age. And they made pretty good and fast recoveries. Some might say Akers went back a little too soon. But I think there's reason to be optimistic with his age and with how early he got the surgery. So hopefully, that would be great to see him back in the playoffs next year.
Yeah, for sure. And you mentioned the speed bridge thing earlier, that being something that football players have used. We don't know if he used it in this case, but that is something that if he did in this circumstance, and you've said there are doctors in New York who do use that method.
There are, yeah.
How much does that improve the recovery time there? And what are some of the factors that, could come into play there if that is what he did end up going through here?
I think from the Arthrex data, Arthrex is the company that makes it. And from their data, it definitely decreases the risk of re-rupture. So that's why it allows you to go back earlier. It seems to cut the recovery by about a third. So I think that the average goes from about 9 to 6 months But the question will be with whether the team wants to take that risk. Is it he's
Are
still
there some risks with it?
well, he could injure something else if he's not ready too. That's the other thing, right? If he's not really confident with that Achilles, and he's you don't want to see him tear his ACL or hurt his knee because he's just not using his ankle reliably. You want him to be 100% when he comes back.
Yeah, so that's something I thought about, especially him getting the surgery in New York. I know we talked a little bit earlier about some of the doctors that could potentially be involved here, and maybe that's just a convenience thing because he was in New York City and they wanted to get it done as fast as possible there, or maybe there was a certain kind of treatment that he wanted to get, and we don't know a lot of that information right now. But Shams did report earlier that the surgery did take place in New York here. No timetable announced for the recovery here, but as we've discussed throughout the show and throughout the day here, it does look like it'll cost him most of that season next year. And that's just devastating for this team, for him. And, the only thing you can hope is that, at the other side of this, he's in a similar position to where he was previously. And, the team figures out some other stuff and some other players who can step up in his absence here. But this is just a stunning development yesterday. Is there anything I didn't ask or any other things you want to say here about this that, we didn't consider?
I think we touched on all the important parts. I don't really have too much else to add. It gives me a lot of PTSD. I wish I wasn't giving this talk right now, or I wish we weren't doing this. Thanks for having me, but
it's always the worst.
I'd much rather be watching him play tomorrow night.
The only time I have you guys on the medical side on is for some bad news like this. And I know we were talking earlier before the announcement. We were holding out a little hope, maybe a partial tear. That's a quicker recovery in that case. And, maybe it was some other injury that was related to that area and wasn't necessarily a Achilles tear. But the Achilles rupture is that full-blown missing a full season, full surgery thing that we typically see at the worst here, right?
Yeah, and in case anybody out there, here's one thing we could touch on. Some people know that there is a non-operative, repair for Achilles. Now, obviously, he already had surgery, but some patients, when the Achilles is, when those two pieces of tendon haven't pulled apart too far and they're close together, you don't have to have surgery. You can allow them to come back together just with bracing, a prolonged amount of bracing, but that increases your risk of re-rupture. So for professional athletes like this, you don't want any increased risk of re-rupture. It's about a 9% chance for the non-operative repairs, and it's about a 2% chance in the operative repairs. So, 1 in 50 chance that this tendon ruptures again on Tatum. But that's
Will he potentially be at the game? Is this something you're in the hospital for a little bit with, or is he kind of in that boot and out the door today?
I bet he's going back home already. Most likely he's not even in the hospital anymore.
Right.
Maybe they keep him one night, but that's usually overkill.
And you're in crutches and a boot at this point. Could you see him being at the game tomorrow potentially, or is you just kind of have your foot up right now?
Yeah, I don't think he'll be at the game. They want him that foot up as much as they can right now to reduce swelling. But he's in a boot or what we call a 2-piece cast, so that his foot's going to swell over the next few days, and you don't want him in a cast right now because the cast will put too much pressure as it swells. So they have him in a 2-piece cast, and then eventually when the swelling goes down, they're going to put him in a different cast that's a little more rigid, and they'll probably change that once a week.
All right, I think that's all my questions here. Again, just a devastating injury. We got the bad news earlier today, and the timeline as it stands, typically about 9 months here. That takes you into the late stages of next season at the earliest. And even then, as we discussed here, with that, it's going to take some time for him to get back to normal even after that return here. So this is a long, franchise-altering injury here for the Celtics that just emerged out of nowhere in a series that was already starting to go a little sideways for the Celtics. Now they're going to play tomorrow without Tatum, try to figure it out, keep the series alive for as long as they can here. Appreciate you, Erek. It was great meeting you, and I want you to be able to tell the people a little bit about what you do here with Boston Sports and Biologics.
Yeah, I'm a non-operative sports medicine physician, so I'm not doing surgery all the time. I have some ultrasound guided surgeries that we do that are pretty unique. They're ultrasound guided carpal tunnel releases and hand surgeries, so people don't have to have scars and incisions and long recoveries. But mostly what we do at my office is try to keep these tendon injuries and arthritic injuries out of surgery using either regenerative injections like PRP and stem cells, or some other minimally invasive procedures to try to turn a chronic tendinopathy or tendon injury into a new one that can be, brought back to the field. It's a pretty great office. It's a small private practice, but we love what we do, keeping people, doing what they like.
Yeah, and I know that's Tatum's hope too. I don't believe, as far as I know, he's ever had a surgery. Obviously, hasn't been a guy who's been injured a lot. I know he had a wrist injury 2 years ago that he avoided surgery on and was able to recover without it. And when you're an athlete, you just don't want to go through surgery. It's never a good thing to have that process, especially one as major as this. So you're wondering how it's going to affect him. You're wondering how it's going to alter his career here at this point. And is the focus just on that Achilles at this point, or do you start to worry about some other stuff in a comeback from this?
Luckily, with this one, you don't have to worry about too much else. If with a patellar tendon, you've got to worry about early knee arthritis, because sometimes with the patellar tendon or the quad tendon snaps, that kneecap moves in a way that's unstable and you lose some cartilage underneath the kneecap. With this injury, it doesn't lead to early ankle arthritis. It doesn't lead to other things. It's really, we're just worried about the Achilles primarily.
All right, that's it for us here. Again, appreciate you, Dr. Erek Latzka, joining us here from Boston Sports and Biologics. So great to meet you. Great to talk to you, obviously, under difficult circumstances for a lot of Celtics fans, and including yourself. You're a big Celtics fan as well, right?
Yeah. I grew up here. I've been watching Celtics, Pats, Red Sox, my whole life. And had a kid raised in Seattle, but he was crying himself to sleep last night, even though he's only 6. So
that's tough. Yeah, that's tough. It was a very difficult scene there too.
Wore his Tatum jersey to school this morning.
Yeah, no, I know the teammates were devastated and stuff too. And we didn't get the news until today, but we know like that test for the Achilles is pretty immediate and pretty quick.
Yeah, they knew probably walking off the court.
Yeah, you could tell teammates knew. You could tell Joe Mazzulla knew, and we got the word officially today after the MRI. So that's that. They're going to try to continue without him. There'll be a lot of fallout into the summer here, but wanted to get the medical perspective here. So appreciate you doing that for all of us here today. We'll have some more of that on the website coming as well. We'll write up some of the stuff we talked about here and talking to some other medical professionals about this here. But news today, Jayson Tatum underwent surgery to repair that ruptured right Achilles in New York. His recovery begins, which will be a long one here, and we'll have updates as it progresses into next season. But that's it for us here tonight on the Garden Report. Subscribe, CLNS Media Celtics All Access. We'll have coverage of Game 5 tomorrow in Boston here at 7 o'clock with post-game show to follow after, as well as all the reaction to potentially the season ending or Celtics living to play another day here. So we'll talk to you all then, and that's it for us now. Good night.
No one's sneaking a vegan brownie by me, I'll tell you that.
Okay, you know what, John? We're going to do it.
You have to feel that way too, Bobby.
I have to feel that way?
Let's
slide Al over and make Luke your first center.
Bobby, we gave you Luke an hour early. We're not going to end this on a damn conversation about Luke